All right, we have to talk about the issue that concerns us every day, the air that we are breathing currently, how it affects us. Today is National Pollution Control Day. It was born out of a necessity, and to that end, here's a quick pollution check. This is the air pollution levels in Delhi, real-time air quality index. This is the visual map that we're looking at right now. As you can see on the screen here, quite a few places in the hazardous category. Let me just show you one of these. All right, so this is Shadra industrial area, 491 AQI here, hazardous to say the least. Then we have Indrapuram, Ghaziabad, 197, still unhealthy. 312, let's look at this one, Delhi Institute of Tool Engineering, Wazirpur, 312, again in the hazardous category. You can see here the pins on this map, quite a few places in the hazardous category, and the places that are not, well, they're far from normal levels of what's considered normal, in fact. We all deserve clean air, and to that end, we will be focusing on what we need to be doing as a nation, as individuals. So as I mentioned earlier, today is National Pollution Control Day. That is going to be our top focus for this morning. This day, born out of a disaster, India can never forget. The Bhopal gas leak was a human tragedy, but it was also a wake-up call about how our systems are when safety slips. Decades later, the warning still holds because the threat today is the air we breathe outside our homes. This week showed that clearly Delhi and Mumbai, cities with completely different geography, landed in the same bracket, very poor air. And might I add, no longer is it air just outside of our homes. This is the air that we're breathing constantly. Mumbai had to trigger the strictest pollution controls. That's usually a Delhi headline, but the pattern has shifted. Both cities are being hit by the same mix: vehicles, dust, construction, dirty fuel. And the result is the same everywhere. Longer smog hours, slower wind-packed hospitals, and people struggling with basic breathing. Delhi stays vulnerable because its local emissions stay high, even on days that look clean on paper. We saw that map there. Mumbai is slipping fast because the city is building at a scale the air can't handle anymore, and coastal winds aren't strong enough to save it. So the question for the country on National Pollution Control Day is, if two of India's biggest cities can hit crisis levels in the same week, what are we still not fixing? And what does real year-round pollution control actually look like? Not just emergency firefighting that I'm talking about here. Let's bring in our guest to discuss this. Dr. Sanjeev Bagai, Padma Shri Awardee and Chairman, Nephron Clinic. Thank you so much for joining us, Doctor. Again, I want to begin by asking you, what is the biggest reason that we still perhaps haven't learned all these years later, the lessons that we should have from what happened in the Bhopal gas tragedy, and how does that tie into what we're seeing today?
Good morning to all the viewers. So I think very clearly this is something which is not being addressed adequately. I'm not making any political statements, but this is going on for many decades. We've reached a stage now in which we are losing close to 3 million Indians every year directly related to pollution-induced deaths. That's 18% of the total mortality load in India. We are losing more than 10,000 to 12,000 people in Delhi every year directly because of air pollution. Just 10 micrograms increase in PM 2.5 equivalent to 12,000 excess deaths only in Delhi every year. The statistics keep rolling out. It's not only PM 2.5 or PM 10, it's the ultra-fine particles, it's the micro-nanoplastics, it's the volatile gases, it's the hydrofluorocarbons, it's the heavy metals in the air, it's the toxic gases like methane and benzene. All of them are inflammatory compounds which enter into the body. What do? They induce what we call as oxidative stress and induce pro-oncogens to become oncogens, and cancers increase. Almost 80% increase in cancers of the breast, 25% increase in cancer of the lungs. It hits the pregnancies with excess risk of stillbirths, spontaneous abortions, small for date babies, premature babies, children being born with congenital abnormalities like congenital heart disease, absent limbs, deformities of the brain and kidneys. This is involving kids even more because they are exposed to the early morning air where the fog and the smog and the relative humidity is the most. And kids breathe twice the rate of the respiratory rate as adults, so they inhale 2 times the volume of the pollutants. We need to take this on a very, very aggressive national mode. If we can manage COVID well, which we did, I'm absolutely sure if we put our heart and our brains into it as a one-point agenda, we can tackle this. If we want to become one amongst the best global economies, we have to deal with air pollution. It is cheaper to deal with air pollution because we are preventing deaths, we are preventing mortality, morbidity and complications. We are losing 7 lakh crores every year directly related to air pollution complications. Over to you.
Right now, despite awareness campaigns, pollution levels do remain high. Where exactly are we losing the plot? Is it policy? Is it implementation? Is it public behavior? Because that's something that needs to be discussed as well.
Yeah, so no longer can pollution be an abandoned baby. I think we need a very systematic, cohesive approach. It has to be a synergy amongst various states. I think the Prime Minister's office should institute, I've said this for a very long time, a separate ministry to combat air pollution. Sorry, the cough is because of the air pollution. And we need to actually implement strict guidelines as a national level to combat air pollution, be it the road dust, be it the emissions of the vehicular pollution, be it the industrial dumping, be it the open dhalaus and the waste management, which is not adequate, or indeed the parali burning in North India. All these are a big no-no. It's our constitutional right under Article 21 to live well, to live safe. We need air. If I breathe this air, I'm going to die early. We know, it's published data from Indian journals, Indian authentic research, that we are losing 10 years of our adult life directly because of air pollution. What are we doing in this generation? We've damaged that. 23% stunting of children in terms of physical growth, 69% decrease in cognitive skills in children and young adults. We need this as a mission to implement this, to enforce it, strict guidelines and even stricter punishments for defaulters.
Absolutely. Now, there is plenty of literature available, as you mentioned as well, to show us the effects of air pollution. And we breathe this air every day. It kills millions, as you mentioned, globally each year. Why isn't this perhaps treated with the same urgency as other public health crises? Is it because it doesn't perhaps manifest as an immediate and primary cause in a lot of these cases?
I think there's a level of inertia, there's a level of mental stagnation which has come in. If you look at it, it's not only a winter phenomena. This is happening year-long. The WHO guidelines of AQI are 15 micrograms per meter cube of air. India has set a guideline of 50. Anything more than 50 to 100 is dangerous. Now, it's a question of splitting hairs and reading between the lines. Dangerous, very dangerous, hazardous. This is being fatal. We must look after the next generation. We cannot become a global superpower with this level of pollution. It's damaging our quality of life, our livability, our lifespan, and huge amount of complications. The cancer patients will roll out in the next generations. The congenital deformities, the liver disease, the bone disease, neurological complications. So we need all the states coming on the table, implement a guideline, enforce it, and make sure that the air is clean. This is not going to happen in a year. It's going to take a good 4 to 5 years, but this is achievable. We cannot get rid of air pollution, but it can reach to a level in which at least a human being can breathe. Kids can't go out to the park. Adults can't go for a walk. Working hours have become shortened. This is a sheer, simple, man-made catastrophe.
Right, absolutely. What are the top contributors, would you say, to air pollution in Indian cities today? Which of them are actually within our immediate control?
So, I think road dust, abnormal and absolutely callous norms from the builders and the construction sites, vehicular emissions, industrial wastes which are going into the soil and air, and last and not the least is the farm fires and parali. If you tackle these 5 forefronts on a war footing, at least by next year, the quality of air will improve. It's a simple statistical matter. We are not talking in terms, even once has been mentioned, of the micro nanoparticles of plastic. Number one cause of infertility and cancers. Number one cause of brain and heart attacks. Mere 15 minutes of exposure to this air causes respiratory distress. 3 to 5 days of continuous exposure to this air can cause sudden cardiac arrest at home. Ambient air pollution, even indoors at home, is a reflection of the air outside. We cannot live a life on air purifiers. We cannot live a life in fear of wearing a mask, not sending the children to school, not being able to play sports. This is being unfair. I would request the PMO to intervene strictly, and I'm sure we can achieve this over a period of next 2 years.
Absolutely, and thank you so much for mentioning that, because I was going to come to that as well. Do you actually think air purifiers make a difference, or is this just a quick fix and it's distracting us from the deeper structural issues that we are facing right now? Because there is, as you mentioned as well, there's plenty of literature that's available. We have the numbers, we have the data. What is happening?
So I think air purifiers work for a limited period, in a transient manner, for a limited scope which is in a room. But if your windows and doors are even slightly open, they are not going to work that well. But how many Indians can afford air purifiers? Less than 0.1%. Is that the life which we want? These are just supports to tide away the crisis, but we have to target the origin. It's important to understand every 22 units, micrograms of AQI, which increases in PM 2.5, is equal to smoking one cigarette. The AQI of 500 to 700, sometimes 999 it has been recorded, is equivalent to smoking 40 cigarettes plus in a day without actually touching a cigarette. That's why the never smokers, the risk of lung cancers has increased 25%. In a year, an average Indian smokes 8,000 cigarettes per year. Is that what we want to give to our citizens? The answer is no. We can't sham this. We can't hide away from it. We cannot have an ostrich-like attitude. We have to deal with it by confronting it. Confronting it means identify the sources, tackle it in a time-bound program. It has to be performance-driven. Let the state ministers be directly responsible. Let them report to the PMO. Make sure that the data which is coming is accurate, and give timelines for the results to show.
Right, and let's talk about individual responsibility, what people can do immediately to perhaps guard themselves. What concrete behavioral changes can every citizen start today, something that can genuinely move the needle a little?
I think hygiene is next to God. We should stop littering the roads. We have to stop dumping our garbage on the roads. These emit microfine particles, methane, and other carbon monoxide compounds which are carcinogenic. If a child is going to school, if the school is not in a hybrid mode, they should wear a mask. Children who are vulnerable to asthma, wheezing, which 40% of Indians living in Delhi in children under the age group of 10 are vulnerable to it, should definitely keep an inhaler handy or some prophylactic medication under medical advice. The elderly, the vulnerable, especially the people who are hypertensive, diabetic, obesity, should take extra care. If not urgent, don't expose yourself, especially in the peak hours and late evening hours. Make sure that your respiratory rate is monitored. If you have any breathing difficulty, wheezing, or any breathlessness, don't self-medicate. Consult your doctor immediately.
All right. Now, Dr. Bagai, thank you so much for joining us on the Breakfast Club.